Hi, this is Dr. Alan Lifton, and this is Brainsplained, and today we're answering some common migraine questions. Summer's asking me questions.
Okay, so the first question is, how can I pinpoint what triggers my headache?
So if this is migraine triggers, so migraine triggers require that we keep a diary, so you have to write down, or you can get an app. We used to write down things, now there's apps. And you document when you're having migraines, and what you want to do is look at what was going on before your migraines and see if you can make a correlation. So you want to usually have a food diary that goes along with your migraine diary. If you're female, you want to have a menstrual diary that goes along with your migraine diary, and you probably want to keep track of weather, and because those are such common triggers. There's other famous triggers that a lot of us have the patients keep track of, if that doesn't pinpoint all of them. So changes in sleep, changes in eating and drinking schedule, not being properly hydrated, all those things are usually triggers. So I don't think that's in the first round of things. The first round of things are the other ones, but those are all things you want to track. And then you see if they correlate. And if they correlate consistently, then that's a trigger. So if you eat MSG a bunch of times, or you eat artificial sweeteners a bunch of times.
What's MSG?
Oh, that's monosodium glutamate, also called natural flavorings. It's in a lot of packaged foods, and a lot of Chinese foods.
The next question is, could any of my medicines, such as birth control pills, be making my migraine headaches worse?
Okay, so birth control pills are not very common causes of migraine exacerbation. Some patients do get worse on those. So not all migraines are catamenial, means not all migraines are related to your menstrual cycle. We know that dropping estrogen levels promote migraines, and so a lot of times when you suddenly drop your estrogen levels, you'll get migraines. Some of the birth control pills do that because they give you a time when you stop on your cycle, and then your estrogen levels will drop. Some people who are female who have migraines, their migraines don't seem to be responsive to their period anyway, so they're not that estrogen sensitive. And less than a third of people who take oral contraceptives actually find that they exacerbate migraine frequency.
Okay.
But there's a lot of medicines that are non-oral contraceptives that make migraines worse.
That are non-oral contraceptives. Just
Right,
like
so
regular medicine.
regular medicines that aren't birth control can also make migraines worse.
Okay. So then the next question is there a chance my migraine symptoms might go away in a few years?
Yeah, there's a chance. So migraines are a genetic thing. So once you have them, that means that you're that kind of brain. You're one of those brains that gets migraines. But throughout the course of someone's lifetime, they are very variable. They change a lot. And I've had people who go through a really bad spell of migraines, and then in a few years they're a lot better.
Okay. Next question is, can hypnosis, biofeedback, or other non-drug treatments help?
Yeah, they can. And biofeedback is very effective, and acupuncture is very effective.
What's biofeedback?
Biofeedback is where we consciously train you on how to control what's called your autonomic nervous system, which is things like controlling your heart rate and your blood pressure and your muscle tension. So we usually give you some kind of a device that gives you feedback that are usually going to put you in front of a computer where you can see something. You can see your heart rate, you can see your breathing rate, you can see your muscle tension with a little EMG lead, and they'll say, okay, let's practice making this better. Let's show you what happens when we make it worse. They'll make you think of something that's stressful, and you'll see the numbers. Maybe they'll have like a graph, and there'll be a line, and they'll see the numbers go up, and then they'll tell you to breathe in and breathe out, calm yourself, think about the beach. and you see the numbers go down. And consciously training you to do that is called biofeedback. It's very effective. Acupuncture is also very effective.
Okay. The next question is, could over-the-counter drugs be strong enough to ease my pain? If so, how much should I take and how often should I take them?
The vast majority of patients with migraines get pretty good relief with over-the-counter medications. Almost all of the over-the-counter medications are actually the same medication. So if you look at the back of the bottle and you read the ingredients, even though there's 15 different names for the medicines, they all have the same ingredients. So all the NSAIDs, the non-steroidal anti-inflammatory drugs, are effective for migraine. Tylenol, aspirin, and caffeine are effective for migraine, and combinations of those are effective for migraine. The danger for all of those is if you have excessive use. So excessive use of NSAIDs, non-steroidal anti-inflammatory drugs, can cause stomach problems like ulcers and kidney trouble, and they can be bad for high blood pressure. Excessive use of Tylenol, which is more than 3,000 milligrams per day of continued use, can be bad for your liver. Excessive caffeine, I don't know that I've had too many people that take excessive amounts of caffeine for migraines that are in the dangerous range, so that's not so much of an issue. And most of the formulations have about 65 milligrams of caffeine per dose, so it's about 130 milligrams when you take two. And super toxic doses of caffeine are at about 1,000 milligrams or a gram, or 1,500 for some people. So that's just insomnia. You should not be taking over-the-counter medications for headaches more than 10 times a month, and even 10 times a month is a lot.
So at that point, they should probably get on actual migraine medication if they're finding themselves take it more than 10 times a month regularly.
Yeah, then they need to see someone. If every month you're taking those things more than 10 times, that's concerning, because then you're probably making your migraines worse. You can take them again for the same headache that day if it comes back, although if you're taking the same day for the headache because it comes back, then actually they're not really working.
Mm-hmm.
So I have some patients who come in and they say to me, oh, it works great, and I take it and then my headache's gone, and then I take it again in 3 hours, and then my headache's gone, and then I take it again in 3 hours, and then my headache's gone. So they just keep taking it like multiple doses in a day. That's not working. That didn't work. So just to clarify what it means when I say it worked,
Mm-hmm.
okay, this is what it means. It means that you got a headache, you went and took 2 Aleve, which is naproxen 440 milligrams,
Mm-hmm.
your headache resolved. Half an hour later or 45 minutes later, it was not there, and then it did not come back for the rest of the day, and sometimes maybe it didn't even come back the next day. That works.
Would prescription medications that prevent migraines be likely to help me?
So there's two reasons why I give people medication to prevent headaches. Either they're having too many, or they're having not too many, but their migraines are catastrophic. So some people get migraines and they're complicated migraines. So the worst migraine patient I ever had, she had coma. So she was unresponsive. She couldn't be aroused. You couldn't wake her. And we had to put a feeding tube in her to give her food and water. So she literally could have died from her migraines. And the number of migraines like that you can have is 0. Okay, because they're a disaster. So frequency isn't even on the table anymore, because even if it's only twice a year, it's too many. Now that's extreme, but I have a lot of people who have what I call catastrophic migraines. The migraine lasts for 4 days in a row. They miss work the whole time. They're vomiting the entire time. They actually get dehydrated. They get confused. They can't think. They can't talk to people. It's a disaster. Even if you're only having that 6 times a year, it's too much. So the frequency is low, but it's catastrophic. And then the other reason we give it to people is because it's just too many. And they do, and the medications for prophylactic therapy are very helpful.
What's prophylactic?
Prophylactic is prevention. I'm sorry, that's the medical term for prevention.
Okay, that was the last question.
Okay, well I hope that was brain-splained then.
It was.
Okay.